Hi, everyone. Good morning, good afternoon, or good evening, depending on where you join us from today. On behalf of Global Fund Advocates Network, Asia Pacific, Yoblon Institute, the Global Health Diplomacy, Malaysian AIDS Council, and Malaysian AIDS Foundation, and the Center for Indonesia Strategic Development Initiative, I warmly welcome you to our first session of our Innovative Financing series, breaking down innovative financing tools, the good, the bad, and the ugly. And we're thrilled to have such a diverse group of participants and speakers from across the Asia Pacific region and beyond, all here to deepen our shared understanding of how innovative financing can help address pressing global health challenges. Before we dive into today's exciting agenda, let me quickly go over a few housekeeping notes. To make sure we're all on the same page, this session will be conducted in English, and so please do turn off your videos and mute your microphone to keep the session running smoothly. If you're experiencing slow bandwidth or technical issues, try closing any unnecessary programs or application on your device. We do encourage you to engage through the public chat box. Feel free to share your thoughts, introduce yourself, your reflections, and questions here throughout the session. Please do note that this session is being recorded and that the recording will be made available on our social media channels after the event. Finally, GFAN-AP is committed to maintaining an inclusive and safe space for everyone. Harassment or disruptive behavior will not be tolerated, and participants engaging in such actions may be removed without prior notice. Thank you all for making this a respectful and engaging space today. So let's get started. To help us open today's webinar, I would like to invite our co-organizers from Malaysia and Indonesia to give a few words of welcome. Speaking first will be Hayan Chan, the Deputy Director of Malaysian AIDS Council and Malaysian AIDS Foundation. He will be followed by the CEO and founder of Center for Indonesia Strategic Development Initiative, Dia Samarahsin. So, Hayan, let me give you the floor first. Over to you.
Okay, thank you. Good morning, good afternoon, and good evening to everyone. Thanks, Jennifer, for that kind introduction. We at Malaysia AIDS Council and Malaysia AIDS Foundation are very thrilled to be part of this webinar series. Nothing more important than this very important juncture of global funding for public health cuts. And we are really being part of this what you call a situation. We are here to really support the GFAM invitation to be part of this co-organizer. And we really hope by participating in this webinar as co-organizer, we can spark more discussion for ourselves as well as for our colleagues in the region. So we really hope in the coming series, it will be at use of all of us to look for different ways in terms of our financing of our HIV and health response in future. Over. Thank you, Jennifer.
Great. Thank you so much, Hayan. Let me next invite Dia from CISDI. Dia, over to you.
Hi, Jennifer. Thank you, colleagues here. Nice to see familiar faces. I'm Dia Saminarsi, CEO and founder of CISDI, and we are an organization based in Indonesia, focusing on health policy, advocacy campaign, and research. We welcome this Asia Pacific convening or gathering warmly, because we think we should come together and collect our thoughts, inputs, give our inputs, and also share our expertise and learn from each other of what we have pinpoint during the pandemic and how we can be creative and innovative to answer the financial challenge that we have now and a changing global financial landscape. I wish everyone a very fruitful and effective meeting. Thank you.
Great. Thank you so much, Dia. And thanks again to Hayan. Thank you both of you for helping us start out and setting the context of why this is important for our region, this particular topic. And now let me give the group a quick look at the rest of today's agenda. You've already heard from our country co-organizers. Next, I will be inviting Rachel Ong, the regional coordinator of GFAN AP, to help further set the scene by outlining the objective of this webinar series for us. She will be followed, and I'm honored to have Dr. Crystal Ben, Director of Global Health Diplomacy at the Yopnon Institute, to give us a practical overview of innovative financing, unpacking the tools, opportunities, and challenges later on in the session. And after Crystal's presentation, we'll open the floor for a Q&A moderated by Rafael Garcia, Portfolio Manager at the Yopnon Institute. And finally, we'll wrap up with a closing reflection from Rachel, including next step. So on that note, then let me turn the floor over to Rachel, the regional coordinator of GFAN AP, to help us set the scene for our webinar series. Rachel, over to you.
Great. Thank you so much, Jennifer. My name is Rachel Ong. I'm the regional coordinator for GFAN Asia Pacific, and I'm based in Singapore. I think many of us are still being impacted by some of the rapidly changing financing developments for global health that's happened in the last couple of months. And coming from this region, which is home to over 4.7 billion people, that's more than 60% of the world's population and some of the fastest growing economies, there are some real conversations that we can have to actually spur or push domestic resource mobilization even more with innovative financing. We do know that ODA, which is overseas official development assistance, has been critically a source of support for health systems in many of our countries in this region and low and middle income countries. Yet the flow, as we've learned, has been very unpredictable to meet the growing needs in this region. So this session or these series of webinars, we've hoped to be able to help our colleagues in this region build a better understanding of innovative financing tools and have clear and accessible explanations of what this means, of what innovative financing is, how it differs from traditional health financing mechanisms, and why this is relevant in the current global context of health, especially in our region. We also want to, in the later series, be able to showcase practical examples and lessons learned from our country partners of innovative financing tools and be able to engage over these few sessions and webinars around what key needs there are and what challenges there are and what we can collectively do together to be able to spur stronger political will in countries, have effective governance, and be able to have or support governments, donors, and the private sector to work better and collaborate more effectively with communities and civil society. So thank you so much for joining us today. Back to you, Jen.
Thank you, Rachel. And on that note, I don't want to add anything more. It's with great pleasure for me to invite Dr. Crystal Ben to the session and to help us start diving into this important topic by unpacking what is innovative financing and anything, the good, the bad, and the ugly. So Crystal, over to you. Thank you for being here with us today.
Thanks so much, Jennifer. And I really have to say it is a particular pleasure to, have this opportunity to speak to all of you. As probably quite a few know, I've been closely engaged with all of the co-organizers for many years. I think with GFAN AP from its inception, we've been working very closely together. SISTI has been a very close partner over the last couple of years. And I also remember quite a few interactions with the Malaysian AIDS Council, also, coming to Malaysia in my earlier career in the Global Fund. So it's really a pleasure to work with all of you on this important topic. And I'm joined here in Geneva by my colleagues Javin Chu and then Rafa Garcia, who have helped to prepare the slides and who are here to follow the conversation, to moderate the Q&A, but they're also available for any follow-up that might come out of this presentation. So let's go into Innovative Finance Unpacked and see what we mean by innovative finance. Lots of discussion these days. Next slide, please. And we also know why there is such an interest now in innovative finance because of the alarming trends, also, Rachel, that you alluded to, with the major cuts to global health programs, particularly from the US, but not only from the US. We feel, many of the traditional donors are stepping away from development support overall, but also from a number of the big, global health institutions and programs. So that is the big challenge, and therefore there's a huge interest these days in innovative finance. Everything also exacerbated by climate change, and not the least, I think, also for your region in Asia Pacific. You're well aware of the ongoing and future impact of climate change on your health systems and on the health program. So these are the challenges we are trying to address. Next slide, please. And you can see it's, while the kind of global crisis and the challenges are on the rise, it's not that, the health problems are diminishing, but at the same time, the public capacity to invest is severely constrained. So it is a perfect storm, if you like, that we are facing at the moment, and that's why it is very important to think together how we can address this crisis. Next slide, please. You're all aware that many of the traditional donors have cut or are cutting their development aid. We will share, of course, the slides later on. I don't want to go into all the details here, but you can see that our partners at SIG, they have this donor tracker. You can go to the website and basically get all the kind of numbers and data on ODA trends for different sectors, including health, and that's the worrying trend. There are some exceptions, where there have been increases announced or expected, particularly also from your region. I think Japan and South Korea are considered to be, good examples, and there's some hope that they might maintain or increase their contributions. In Europe, it's Italy, but also maybe Spain is a country to mention here that has made quite, promising, announcements on that. And we will see how that will play out in the upcoming replenishments. That is first Gavi. They have their replenishment in June, 25th of June, hosted by the European Commission in Brussels, and then the Global Fund later in the year. Next slide, please. So, and many of these, issues are also exacerbated by the debt crisis that, many low and middle income countries are facing. Again, you have lots of numbers here and in our database, but the trend that so many countries are spending now more on debt repayments and interest payments than on actual investments in their domestic health and education budgets. That's a very worrying trend. And that is one of the factors why we have been focusing quite a bit on debt swaps that we will come to in more detail later on, because that's the background. Countries are facing this challenging environment, diminished international support while they are dealing with increasing debt burden and the repayments of the outstanding debts. Next slide, please. So, traditional models increasingly unable to meet the growing demands, and innovative finance is a complementary approach to unlock capital, leverage private sector investments, and drive long-term outcomes. Next slide. And I think this is very important for me that we have a realistic understanding of what innovative finance can do and what it cannot do. Sometimes I feel there is the expectations are unrealistic, as if innovative finance can solve all the issues that we've mentioned before. It can certainly contribute to that, but we have to be realistic what can be done and what not. And often I feel that, there's a lot of talk about innovative finance without completely understanding, what do we mean by that? And that's why we have proposed this table that you see on the screen, and I will go a little bit more in detail into that so that we have this common understanding. Because innovative finance mechanisms, they range from, you know, those that are voluntary contributions, they add net capital and resources to international health organizations and programs. And then if you move towards the right, then you have more instruments that actually, you know, do provide resources, but also expect financial returns. And so that's the kind of graph, if you like, from the left to the right, from, you know, pure contributions to more investments where particularly the private sector, the bond markets, they expect returns on their investments. And that's a very important distinction. So if we start with the left, voluntary contributions, you know, if philanthropic platforms, philanthropic organizations, high net worth individuals, they make contributions as they do, that can be qualified as voluntary contributions. It's usually net transfer to a given program or organization. Or if there is a kind of collective initiative by the corporate sector, and the most prominent of those is Product Red in the context of the Global Fund that quite a few of you will be familiar with, an initiative that started way back in 2006, where by now more than 60 companies have come together to make contributions to the Global Fund for their AIDS programs. These are pure voluntary contributions. These companies do not expect any financial return. They might expect a return in terms of helping them to brand their company. They might expect that it helps them with addressing their, you know, clients, their customers. Particularly young people often want to know that the companies from which they purchase, you know, attractive commodities do also something good in the world and that they can identify with. So therefore, there is a benefit for these companies, but not a financial one. Whatever they contribute is pure contribution. Product Red has contributed more than 800 million to the Global Fund over all those years. So that's one category. Very easy in terms of, you know, the benefits. But of course, the challenge is to convince enough, you know, foundations, philanthropists, corporate companies to contribute in that way. And then there is the conditional funding. So it's still kind of 100% net transfer of financing to a particular cause, but it is, you know, conditional. And debt swaps is maybe the most prominent among those, and I will go into more detail on my next slides, but just that you might remember, that's where we can put debt swaps, because the debt that is cancelled is then transferred into programs 100%. There is no kind of expectation of any repayment from the recipient country, ministry, or international organization. There are also models of cash on delivery that fall into that category. It is a cash transfer to a given country. The cash is dependent on performance, and that's why it's called performance-based funding, but it is 100% transfer to the programs with no expectation of return. It's just conditional upon the performance. Then you have catalytic funding, advanced market commitments. Very important tool, has been particularly used by Gavi to provide incentives for the research and development into vaccines, so that those who do invest in the research for that, they can have the reassurance that once a product becomes available, that there is market, that there is, you know, capital to finance that, in this case through Gavi. So that's another model that has worked quite well, mainly catalyzing innovations in terms of product development and making those innovations then rapidly available in all countries around the world. If we move further to the right, then we come into what is called blended finance, where you blend, grant money, that's the easiest and the most attractive for countries, with concessional loans. That often means you also combine grant-making organizations like the Global Fund, Gavi, and others with banks, development banks that provide these concessional loans. You can have loan buy-downs that has been tried, in a number of countries. So you use grant money to buy down, if you like, the interest rates and so on for the recipient country, thereby making it more attractive for them to take out these loans, but also then increasing the volume significantly. But here you get into the territory where it's not just the kind of cash transfer, there's also the expectation that, there are reflows. Of course, loans are loans and credits are credits. And the creditors expect that this will be repaid. Also in this category, you have what many of you might be familiar with, what Gavi has used, the Innovative Finance Facility for vaccines, IFFIm. A mechanism where they use long-term pledges from public donor countries, particularly the UK, Norway, Spain, Netherlands have been involved in that. They say, okay, we give money for, let's say, 10 years or even a bit longer to Gavi. But with this guarantee, Gavi can go to the financial market and raise the money immediately. So it's a front loading. It doesn't add money to that, but instead of expecting, long-term flows from these donor countries, they can mobilize that immediately and make that available. It's an interesting model, has been very helpful for Gavi, because for vaccines, you can say, hey, this is a one-shot thing. If we have front-loaded money, we can vaccinate more children and the children remain vaccinated. But it is not a good model for recurrent costs because you have spent the money once and you won't get it back. And then you have to repay your investors that have, front-loaded your money. That's why when I was in the Global Fund and I was often asked, why don't you also implement something like IFFIm? The answer was for the particular model of the Global Fund that invests a lot in lifelong antiretroviral treatment or malaria programs where you have to replace the bed nets every 3 years. Then the front loading doesn't help because you need continuous flow of funding over many years. So you always have to differentiate also which mechanism works for what, and not all are, particularly conducive to all situations. And then further to the right, you come to socially responsible investments. That many corporations, want to invest in ecology, sustainability, governance investments, impact investment funds, social investment impact bonds. Interesting ones, you can mobilize private sector resources here. But again, it's usually private sector investment that they expect to be repaid once the results have to be achieved. So can be, very helpful for certain situations, but less so for others. Generally speaking, when you come to capital investments, let's say also in the climate space, if countries want to invest in renewable energies and so on, then it might make sense to focus more on loans because there is also, economic benefit. If you look at, the recurrent costs in health, that have to be maintained over many years, then grants obviously is the more appropriate mechanism. So that might give you a little bit of a kind of categorization of different innovative finance mechanisms so that we know what we're talking about when we say, hey, we should do more on innovative finance. We need to know what we mean by that. Then there is another important category that is often also mentioned in the context of innovative finance, and those are the earmarked taxes. Now, There might be people who would argue, and I'm included in that group, who would first of all say, hey, taxes are not exactly, particularly innovative, right? They've been used over centuries and more by governments to raise money, to provide the government services. So what we mean by innovative taxes is if there are taxes that are particularly earmarked for certain purposes. And there have been examples for that. Most prominent, probably the airline levy that France and a number of other countries introduced in the year 2006. So on every flight out of France and out of other countries that joined this scheme, there is then a certain share, a levy, that goes into a fund, and out of this fund they've paid Unitate, for example, they've paid part of their contribution to the Global Fund and also to a few other international organizations. Republic of Korea has been using that for many years as well, as they were one of the kind of founders of the airline levy. So it's an interesting model. The key was that those countries not only agreed to kind of have this tax on airline travel, any country can do that, but they agreed so far to earmark that for the fight against infectious diseases. This is under pressure right now, also in France, some of you might have heard, with the kind of new government and the pressures on the budget. They might not cancel the levies altogether, but they are questioning whether all of that would go into fighting infectious diseases or whether it will go into the big pot of government finance. So that's the airline levy. There are many other taxes that are being discussed right now. Quite interesting is the International Maritime Organization that has been discussing shipping levies on all the kind of container transport around the world. So to kind of issue a certain levy on that and make that money available, particularly for climate organizations, but also potentially others. The conversations are quite advanced. The Green Climate Fund is very much involved in that, but we also have seen, there were just conversations last month that of course now the US is opposing this quite strongly. So it's not very easy to get consensus around these levies and taxes, as you can imagine. And this requires, of course, a coordinated approach. It cannot be that one company or one country, issues levies on container, transport. It has to be as an international community, and that's the limitation, if you like. What is easier for countries is to raise taxes on, let's say, sugar, alcohol, tobacco, what we sometimes call sin taxes. That can be done at a national level and can be a helpful means to increase government resources, and they can decide then to invest that into health programs and so on. So there are real opportunities. I will have a slide later on that focuses on that in a bit more detail, but I want you to be aware that often these earmarked taxes are included into innovative finance, but for me, they are a bit of a different category from all the others that you find on this slide here. All right. I hope that gives a clear overview of the taxonomy, and we can move to the next slide, please. So then to the debt to health that we single out in this presentation on the one hand because I have the most experience with that. The Global Fund introduced that mechanism in 2006 and has been implementing lots of transactions around that over time. And I will explain on the next slide how it works. But just to see, there have been 14 transactions between different creditor and debtor countries so far. It has been mobilizing not billions, but in the millions of resources that go directly into the countries that are participating in that. Just last year, Germany concluded 2 additional debt swaps, one with Indonesia, 75 million euro, and one with Mongolia, that was roughly 30 million euro. So it's still ongoing. Many countries have participated in that. And before explaining how that works in a bit more detail, one piece of information that came up just last week, and therefore it's not included in our slides. Many of you might be aware that there is a big conference coming up, Financing for Development. It's organized by the UN. It happens only every 10 years. Therefore, it's quite critical, for the policies, for the strategies around financing development. The next conference will be hosted by Spain, end of June, early July. And first of all, in the outcome document that all the UN member states circulated, debt swaps were mentioned quite prominently in several parts of the document. And debt swaps are not just used for health. They're also quite prominent for climate and nature. There are quite big swaps for that, and also for food security. The World Food Programme is using this instrument. So we use it for health, agriculture, nutrition, and climate and nature. And our team has asked the Indonesian government actually to co-host a side event, an official side event on this, together with the Global Fund. And the Indonesian Ministry of Finance has agreed to that. So we've submitted that as an official side event with the government of Indonesia. If you feel that any of the countries you are, working in might be interested in that, we are happy to invite additional governments. Certainly from the creditor side, we will be inviting Spain, Germany, Australia, countries that already have experience with that. But if you have other, so that you feel your governments might be, conducive to that, we are happy to invite other participants as well. And to the question that just, popped up, yes, these are debt swaps in health. These are debt swaps between 2 governments. And it's called bilateral or trilateral debt swap, 2 countries, not a kind of multilateral arrangement. For climate and nature, it has also involved private sector debt, at least private sector debt through private banks. But in health, it's exclusively government to government. All right, next slide, please. So this is how it works. Any given creditor country that has outstanding debt to a number of debtor countries can decide that they offer part of the outstanding debt to be cancelled, and then the beneficiary country has the reduction in the debt burden and agrees to invest that exact amount into their health programs. In this case, facilitated by the Global Fund. That's why it's a tripartite agreement in the example of the Global Fund, but it can also be done in other ways. But it's in principle very straightforward. The creditor cancels the debt, and that is without any expectation of any further repayment, but with the expectation that the exact amount is invested in agreed, health programs in the debtor country. And the use of the money is then, in this case, guaranteed by a third party, like the Global Fund, that provides the accountability, the oversight over the use of the money. So that's how it works in principle. Next slide, please. It is important to say what it is and what it is not. And I presented this also at the G20, because last year Brazil had been promoting debt swaps for health quite strongly, and had invited me to address the G20 Health and Finance Task Force. And this is exactly the slide that I showed there as well. Debt to health is a bilateral agreement between a creditor and a debtor country. That's the advantage. You don't need to go to the Paris Club or to any other multilateral, forum or the World Bank or anything. 2 countries can agree on that. They don't need to ask anybody else. It is a debt conversion mechanism, rechanneling the debt payments to domestic investments in health. So we actually say it is a method to increase domestic spending on health. And it should not be seen as a tool for countries in debt distress. The amounts that we are talking about here are usually not that big. So they are helpful, but not the solution to a country that is really in debt distress. And, debtor countries also, don't want to give the impression that they are in debt distress. They're interested in reducing their debt, but we have to differentiate between that so that it doesn't have any effect on their credit rating, for example. So it's not a multilateral instrument, it's not just debt restructuring, and it's not a solution to the debt crisis, but it can be helpful for domestic investments in health. Next slide, please. So I'll probably, leave that to you and then go to the next one, and you can study the slides in more detail when we share them. Next slide, please. So I briefly already touched on the global levies, the taxes for development, and this is certainly something worthwhile also for all of you to look into in more detail, maybe also in a future session. There are lots of working groups right now looking into the various forms of international levies. There is a Global Solidarity Levies Task Force that is actually, managed by a secretariat led by a colleague that many of you might know, Friederike Röder. She used to work for One and then for Global Citizen, and she's now leading this task force. So it has a lot of potential, but one also has to see that, of course, introducing new taxes for a government is not an easy decision, and it often also takes time to implement that and to get the agreement, but worth looking into it in the future. Next slide, please. Then I want to mention here also the principles of global public investment, and some of you might have heard me and others talk about that over the last few years. Global public investment is not an innovative finance mechanism, but it is a new approach to finance global public goods, or what we often call global public benefits. But it emphasizes the continued need of large-scale public investment, and I think that is a very important point. Sometimes it's given the impression that private sector and their instruments can replace public investments. We don't think that is the case. We still need a lot of global public investment, but from all countries according to their ability, because then all countries will also benefit from that. And it is a new narrative, it's a new paradigm that is replacing the old, outdated, narrative of development aid into something that all contribute to, because we all benefit and all countries need to be represented in governance. GPI was also recognized by the recent Lancet Commission on Investing in Health as one of the kind of paradigms that should be used for considering stronger investments in health. So just to mention that here. Next slide, and I'm coming to the end then. So global cooperation and financing have been instrumental in achieving major milestones that today make our world healthier and more secure than ever before. And I close with a reference, next slide, to the recent Lancet Commission on Investing in Health that was published end of last year. And that is talking still about the huge opportunities that we have. Halving premature death is within reach by 2050. It's quite amazing the progress that has been achieved over the last decades, and it is still amazing what can be achieved if we all work together. And the Lancet Commission is quite confident that in spite of all the factors that are challenging right now, we can achieve that by working together and finding the right mix of financing, domestic and international, for that. My last slide has a couple of conclusions, but I will just leave that with you for consideration. But of course, you know, everything we discuss here is based on the assumption that we need more investment still in providing quality healthcare for all people in need, based on the principles of primary healthcare and universal health coverage. I think I'll leave that here. I think there is a final slide on conclusions and takeaway, but I think I've already used my time for speaking. So we leave that for the discussion. Thank you so much.
Thank you so much, Christophe, for that amazing and comprehensive overview. I think like in the words of my teenage son, right? It's like, wow, my mind is blown. But lots of food for thought and opportunities. And for the participants, we'll be making the slides and the recording available, because I think, at least for me, I think there are just a lot of points that I personally would want to go back and restudy again, as well myself. So without taking up too much time, I'd like to invite Rafael Garcia from Christophe's team, the portfolio manager for Yilmaz Institute, to help us facilitate Q&A. And I'm sure there are lots of questions or clarifications that people might want to have. So Rafael, over to you.
Thank you, Jen, and thank you everyone for being here today. As I mentioned already in the chat, we will welcome very much your questions, also your thoughts, your comments, your reactions to these points that Christophe has raised. And exactly, I would invite you to raise your hand so we can keep in order. For those who feel also more comfortable sharing comments in the chat, that's also another option that you can consider, and I'll be happy to pass this to Christophe, that I have the privilege to having next to me. So why don't we start? I can see Aslan from the Peace Foundation. So Aslan, would you like to go first? Aslan, I think your microphone is muted.
Of innovative financing, but how a local organization, national-based organization, can strategize to access such kind of innovative funding? As you know, we were engaged in, most of us engaged in traditional funding since long. So our preparedness, our thinking means our knowledge is running surrounding traditional funding. So have you example, as you get example of Gavi and other organization, how a local or national-based organization can strategize itself? You know, in these days, we are stuck in the halfway. Suddenly, financing and other things are very closed. And donor organizations have also preferences to go to peaceful cities or peaceful countries where there is easy to work, but where there is difficult to work, I think they do not come easily. So I want to know that how can we strategize to access such kind of funding? As you know that crowdfunding and CSR and other things, we are already working on them, but they are taking so much time. But whenever you have disaster or such kind of emergencies, how can an organization can apply such kind of thing? No doubt it is need of time, innovative financing, but now it is need also to know like us more about more. So we want to get an opportunity from your program today. Thank you.
Thank you, Aslan. I will take another question, and I can see others in the chat, but I'll pass it over to Sonal.
Thank you. Hi, Christopher. My question is very much in line with what Aslan was saying, but more specific around impact bonds. Like as a civil society, probably impact bonds might be something that some of the organizations might be interested in investing in us. And I wanted to know if there are any specific global organizations who are kind of, front runners on that. We tried to do work with some of the organizations, but we realized that a lot of donor organizations also are very nervous about impact on themselves. Civil society also, but both ways. So just wanted to know a little bit more around that area. Thank you.
Thank you, Sonal. So I think, Krishna, we can address these questions. And also on the chat, we have one question on what would be your recommendation for countries facing the funding cuts from the US for health programs to start reviewing the process on which innovative finances options could be feasible. And there's another one also on FFD4, and then we can share also more of how we're planning to come to Sevilla. So.
Right. Thanks for those questions. First, Aslam and then Sonal. Obviously, a very important point, how can national organizations benefit from innovative finance schemes? So now you mentioned the impact bonds is usually something that is implemented at the national level. There have been examples of that. I think in India in particular, there have been social impact bonds in the education sector. I know in some other countries, impact bonds have been used for programs, for example, malaria and so on. Again, if you look at my taxonomy, you will know this is, you attract private sector money, but they expect to be paid back if the results are achieved. It can still be a very interesting model. But also what we've seen, and the Global Fund has done a few of those impact bonds, the transaction cost can be considerable. But in more general, I think a number of these innovative finance mechanisms do work through international organizations like Gavi, like UNITAID, like Global Fund, so that the money is raised, through the innovative finance mechanisms and then channeled through international organizations. Aslam, I don't know where you are based, but so now of course, I remember our collaboration. And in India, I think one interesting example that had been established is the India Health Fund. So particularly for the national context in India. Set up with the help of the Global Fund, still kind of attracting philanthropic money in India, and that could apply also in other countries. The first category in my taxonomy, attracting philanthropic money. In Indonesia, you have powerful philanthropists, and in many other countries as well. I know in Vietnam and Thailand, we have been in touch with high net worth individuals. That would be in that category where maybe additional money can flow then to national organizations. And yes, the US cuts, that is the context in which innovative finance will be increasingly being discussed. Debt swaps, for example, could be one of those answers. Some of you know I'm quite involved in the question of malaria elimination in Asia Pacific. I'm chairing APAMA, Asia Pacific Leaders Malaria Alliance, with a goal to eliminate malaria from the Asia Pacific. There we do look at debt swaps as a method to kind of complement sometimes the loss of funding, because the US has also been a big funder for malaria programs. So that is an option at least to look at. Thank you.
Great. I would like to ask if there are additional questions or comments. Feel free to raise your hand now. And in the meantime, I think we can also share a little bit of how do we see Sevilla, the conference, the financing conference for development. And, it will be taking place by the end of June and the first week of July, 30th of June to the 3rd of July. It's a big event that, as Christoph has mentioned, only happens certain amount of years. It's even one per decade almost. And it couldn't come at a more critical time. So I think that Even though the program and the outcome document has been following these more UN bureaucratic process, like having all countries negotiating, I think the discussion there will be very significant, very rich, given what's happening in the world. And we're trying to know what's going to happen there. The official program is not yet out. Last week ended the submission, the application or for submitting a sideline event proposal, and that's where we have shared with you that we are trying to have an official sideline event on debt swaps, but we know that there will be many more taking place as well. We would expect to see probably an agenda more towards the end of May or early June. We know that there are also more partners from many different sectors, health including, that will be attending, and it will be, of course, a great time for networking. But we would see a lot of discussions around taxes, innovative financing, tools such as debt swaps, probably blended financing, of course, also a lot of discussion on what are the drivers of this issue, such as debt and all the economic indicators mix, inflation, interest rates, the cost of capital for countries. And I think for us, our focus would be very much on debt swaps, on making sure that there's a good crowd of people or advocates and also governments that we can bring closer to this topic to ensure that there are incentives for moving forward with debt swaps, but that also we can understand what's their complexity and how can we work in making them more accessible for different countries. And the other aspect that we'll be focusing on is also the global public investment model, trying to have a conversation that is multi-sector, multi-stakeholder, to discuss how is it that we can advance this paradigm and start moving to more to this way of financing public goods that have global benefits. So I don't know, Christoph, if you would add anything.
No, I think, yes, we can share information, and we would like to hear from any of you, is any of you considering to attend? Because I know many civil society organizations also have applied for that. Or if you're in touch with your respective governments, and that we can be in touch with them. Maybe to address the question that came up in the chat from Salome, important point, you're quite right. There are lots of proposals these days on new funds, like what you mentioned, the Global Cancer Fund. There is a hepatitis fund, there is a global surgery fund, there are all kinds of funds, usually now very small. We have the World Health Assembly coming up here in 2 weeks' time, where there will be lots of discussions, of course, also on health financing, many side events by those funds, big and small. But indeed, a fund is not yet an innovative finance mechanism because these funds need to be financed, first of all. And I think what you're indicating there is exactly also my impression. I mean, it's probably not the time now to proliferate and have more and more small funds that are poorly funded. It's more the question of an integrated approach. I think that's much more the push right now, and that's correct. We need to come to a better funding of the health needs of populations, particularly low and middle income countries, based on the primary healthcare and UHC principles. And proliferation of funds is probably not the answer to that. But you can imagine there will be quite a bit of discussion on that during the World Health Assembly in Geneva in 2 weeks.
Sure. So I think thank you everyone for joining us today. And I think Christoph has only touched the tip of the iceberg. There are so many other innovative financing tools that we could go on about in terms of whether they're actually, not to say useful, but whether they would actually meaningfully include or engage communities and civil society in their processes. There there seems to be quite an appetite to actually have more understanding of other tools and how they are applicable in countries. But just to remind everybody that innovative financing tools are a tool for a longer term solution, but they're not a quick fix. We do need communities and civil society to be meaningfully engaged at the country level in terms of domestic resource mobilization efforts to keep governments accountable. And they're not a fix for things that we should be looking at in terms of progressive taxation and healthy taxation systems in countries that can actually support a country's growth and their different budgets, not only for health. So thank you all again for your time. We're looking forward to you joining us for our next webinar session, where we will hear a little bit more from our country partners. I just want to remind people that are interested and that would like to be involved with the session that's going to be in Seville, to please follow up with Raphael. Raphael, would you like to share your email address if you've not done so in the chat box for people so that they can reach out to you? And we would actually also look forward for you to actually let us know what else you would like to learn more about in the future sessions. And as Christoph has said, we'd be very happy to support you in your countries in terms of putting you in touch with the right people or supporting you in your conversations in terms of engaging or rolling out in some of these tools. Do note that they're actually tools that are meant to be they're not something that will happen overnight. They're definitely something that will take months or even years of discussions and implementation. So we're looking forward to everyone's more active engagement in this region. And thank you so much, Christoph. Thank you so much, Raphael. And thank you all for being with us today. Have a good day, evening, or night.
Thank you, everyone. See you next
Thank you.